Hi, I am Dr. Yeshwant Mane, Director, Atharva Infertility Center, Nashik. I am a practicing IVF specialist since last 15 years. Today we will be discussing certain very important tips following embryo transfer which will enhance the success rate following IVF. As all of you know, unfortunately, IVF doesn't assure a 100% guarantee or a 100% success rate. IVF has its own limitations, but with the recent advances in medical science, patients who were unable to conceive, say, last 40 years, these patients with treatment and advancement of science can definitely conceive with IVF. Now, what are the most important tips following IVF? The most important thing the patient needs to follow is to take her medicines regularly as prescribed by the doctor. So these medicines following embryo transfer which are given, these are called as luteal phase support. So this luteal phase support medicines, this will help in sustaining the endometrium and assist the embryo in implanting and attaching to the uterus. Sometimes the doctor may prescribe some injections and they need to be taken intramuscularly as advised by the doctor. These luteal phase support medicines, these are hormonal injections. They need to be taken at regular intervals. Certain medicines are taken orally, certain medicines are taken vaginally, and certain injections are taken intramuscularly. The second most important thing which we advise to all patients following embryo transfer is to have adequate bed rest. But it doesn't mean that the patient should be in bed rest for all the time for 24 hours. Patient can do her regular day-to-day activities. She can even do her kitchen activities, and we in fact promote that females who are working to have their daily routine office work. In fact, we even advise patients to drive two-wheelers or four-wheelers if they were driving previously before the transfer, and they can do their office job at regular intervals. In fact, in Western countries, females drive to the IVF clinic on their own. They get the embryo transfer. Post embryo transfer, after half an hour of bed rest, they go back to the office and they do their day-to-day activities. So, especially in Indian scenario, there is a great concern among the patients following embryo transfer that bed rest is very important. This is a myth. So, bed rest is absolutely not required. There are some general instructions which we advise and give to the patients, that don't lift heavy weight and don't do strenuous activities. Patients have the illusion, or patients have that misconception that once the embryos are transferred back into the uterus, if they stand for a longer time, if they do day-to-day activities, the embryo may fall down. But unfortunately, this is absolutely wrong. Once the embryos are transferred back into the uterus, they are in that place, and whatever activities the patient do, the embryos don't move from that particular spot. The third most important tip is diet. It is advised that the patient should have short and small frequent diets. Instead of having diet in too large portions, it is advised that the patient should have diet at 4 to 6 hours of interval. Like they have their breakfast in the morning, the lunch in the afternoon. Suppose if they have 2 chapatis in afternoon, it is advised they eat 1.5 chapati. So by evening time, by 4 to 5 hours, she has some dietary cramps, and she is advised to take a small diet at evening time. And in bedtime, again she can have, instead of 2 chapatis, 1.5 chapati and small portion of rice, and follow her diet very cautiously. There is no need to prevent any dietary restrictions. Like many times we hear patients that this we have heard, or this we have read somewhere else, that this food is not good following embryo transfer, or this food is good following post embryo transfer. This is absolutely wrong. Patients can have whatever they want, whenever they want, wherever they want. And next important tip that is to be followed is to have a stress-free environment. Post embryo transfer, there are certain hormones which are released from the brain, and if the female takes lots of stress, the stress hormones which are released from the pituitary, they act negatively on the endometrium. So we advise the patients to have a completely stress-free life. In fact, they can do their job hobbies like listening to good music, reading a good book, or in Maharashtra, like we advise people to read Ramayana or Gnaneshwari. And the last and most important thing is try to avoid going to in common public place. The intention behind this is to avoid unnecessary respiratory infections. If you have respiratory infection, then you have a chance of fever. So if you have fever following post-embryo transfer, it significantly has a negative effect on the implantation of the embryo. So patients should avoid going to crowded places and avoid respiratory infections. So these are the only 5 important tips that will help in improving the success rate. Apart from this, if the patient is consuming lots of caffeine, coffee, it is advised to cut down on the intake of caffeine, and patients should avoid taking alcohol or smoking. Thank you.